10 Early Cancer Symptoms and Signs You Shouldn't Ignore. Cancer is more easily cured if treated early. It is therefore essential to diagnose it early. Certain symptoms may represent warning signs of cancer and should therefore lead the patient to seek medical attention. Fortunately, in the majority of cases, these signs are caused by much less serious illnesses. Nevertheless, the occurrence of any early signs of cancer should not be ignored. 1. Unexplainable weight loss and loss of appetite. Sudden weight loss that is not the result of a strict diet is definitely a warning that something is going on in our digestive system. This can be linked to colon cancer and other digestive cancers, but can also be a sign that cancer has spread to the liver, which is unable to get rid of waste, causing loss of appetite. Feeling full and unable to eat can be a symptom of ovarian cancer. It is a fact that half of people with cancer lose weight by the time they are diagnosed, so take this early warning sign seriously and talk to your doctor. 2. Shortness of breath, wheezing or constant coughing. Shortness of breath can be a symptom of many conditions, most of them benign, but it is one of the first symptoms of lung cancer. If you are experiencing shortness of breath which is accompanied by wheezing and constant coughing, make sure to get checked by the doctor as soon as possible. 3. Frequent infections and low-level fevers. Cancer weakens your immune system, causing more frequent infections and unexplained fevers, usually low-grade, that won't go away. Fevers are usually present when the cancer has spread to a new area or is affecting the immune system. These symptoms usually appear with blood cancers like leukemia and lymphoma. Check other symptoms of these cancers, and if you have some of them, do not delay visiting your doctor. 4. Wound that does not heal. What is normal about our skin is that it has the power to repair itself very quickly, so any damage usually heals within a week or two. However, if you notice that a sore, wart or spot isn't healing even after several weeks, it's definitely time for a checkup. This is okay even if the wound is painless. 5. Thickening or bumps anywhere on the body. Soft tissue cancers in the body can often be seen through the skin. This includes breast cancer, testicular cancer, as well as cancer of the lymph nodes. Check for any lumps or thickenings anywhere on your body and report them to your doctor, especially if you notice them changing in size. 6. Changing bowel or bladder habits. Any drastic change in bowel movements as well as bladder habits should be reported to a doctor immediately. We're talking about long-term constipation, diarrhea, or a change in stool size that could be a symptom of cancer. A change in urine color or the presence of blood in the urine, pain during urination can be linked to prostate or bladder cancer. 7. Unusual bleeding or discharge. Any unusual bleeding can be a sign of cancer once its early, more advanced stages are reached. For example, coughing up blood can be a sign of lung cancer, while blood in the stool can be the result of colon cancer. Any unusual vaginal bleeding can be linked to cervical cancer. Blood in the urine can indicate the presence of bladder or kidney cancer, while bloody discharge from the nipples can be a sign of breast cancer. 8. Indigestion or difficulty swallowing. Indigestion and difficulty swallowing aren't usually linked to cancer, but it's good to know that if these symptoms don't go away, they could be a sign of stomach, esophageal, or pharyngeal cancer, throat. Having difficulty swallowing can also be a sign of lung cancer. So if you experience these symptoms for a longer period of time, check your condition with the doctor. 9. Obvious change in the appearance of a wart, mole, or sore in the mouth. It is a rule that any change in the size, color, shape, thickness of a wart, mole, freckle should be checked by a doctor as soon as possible. This includes any skin change because it can be a sign of melanoma or skin cancer, and for this type of cancer, early diagnosis is crucial. If treated in time, it can be cured. 10. Persistent headache, fatigue, nausea, or vomiting. Extreme fatigue, persistent headaches, nausea, or vomiting that won't go away can be a sign of spreading cancer. Leukemia can cause fatigue, but it can also be a sign of colon or stomach cancer, which causes blood loss, which can also lead to fatigue. Persistent headaches may result from a growing brain tumor. If you have any of these symptoms, and if they last for a longer period of time, it's time to get your condition checked out by a doctor. Thanks for watching. Please subscribe to my channel and don't forget to like and share my video.